Welcome back to another episode where I help younger physicians decrease stress and increase income by transitioning from corporate to independent practices, even without any business experience. Now here's today's crazy story. Patient with pasta on his belly. Before joining my current practice, I worked in a downtown emergency room in Miami. It used to be called Cedars Medical Center, and I believe University of Miami bought them. I had a fair number of interesting stories, but one stands out till this day. It was a nursing home patient that had mild dementia who presented to the ER after having bowel surgery. He was a very poor historian, and it was difficult for the nurses to get anything out of him. They told me that he had food on his abdomen and that he had abdominal pain, and they really couldn't tell me much more. Upon examining him, there was definitely food on his belly. It was spaghetti that he must have had for lunch. The problem was that it wasn't inside his bowel. It was outside of his bowel. The patient had a dehisced abdominal wound, and the nursing staff was unaware of this. And when I went to examine the patient, pull the gown up, the patient had I saw peristalsis of his bowels with spaghetti on top of it. Needless to say, he was taken to the OR for an emergency surgery. Do you want to hear more stories like this? Subscribe to our podcast and never miss an episode.